Hello friends, welcome to Creative Medicine. In this lecture, we will learn about which of the following do not decrease the angiotensin 2 activity. ACE inhibitors like enalapril and and valsartan, which is ARB, decreases the angiotensin converting enzyme, whereas omaprilat is a vasopeptidase inhibitor. Because it is a vasopeptidase inhibitor, it inhibits both ACE inhibitors and it also inhibits the NEP inhibitors. So as a result, nesiritide does not increase the angiotensin 2 activity, does not decrease angiotensin 2 activity. Nesiritide is actually a recombinant BNP analog. Which of the following is not true about the use of beta blockers in congestive heart failure? Beta blockers should be started at very low doses and slowly titrated upwards. Carvedilol is most widely used beta blocker. True, it is the drug of choice in acute decompensated heart failure. No, it is used in chronic heart failure, not in acute decompensated heart failure. It can reduce the mortality in congestive heart failure. True, this is false. Thank you and thank you for watching.